Hi everybody, Dr. Nash here. Wanted to talk to you today about a subtle and complex condition that is really affecting so many people, and it's widely underdiagnosed, which is, it's also got a lot of letters in the name, which is ME slash CFIDS or ME CFIDS, which stands for Myeloencephalitis, chronic fatigue infectious disease syndrome. This is primarily a condition, a syndrome, a panoply of different symptoms affecting the neurological system, usually due to a latent virus or even a subacute or even an acute viral infection. But when it goes chronic, you can have any number of neurological symptoms that relate to the myeloencephalitis. Anytime you hear itis on a condition or disease, it means that it's related to inflammation. So this is primarily an inflammation of the brain and the spinal cord, and it can cause symptoms ranging from fatigue, which is one of the main symptoms, to exercise intolerance, even with mild or moderate activity. Some people experience lightheadedness or nausea or dizziness, and then also cognitive deficits like brain fog, memory loss, and sometimes sleep disturbances as well. And it can also affect mood, as you might imagine, but sometimes the mood disorders are sort of secondary to struggling with this chronic condition. So the main ways that I address this is addressing viral persistence, addressing the hypersensitivity of the immune system, in particular certain parts of the cytokine pathways, which are inflammatory molecules, and also looking at your diet and microbiome health, which plays into this, but also dealing directly with the effects of inflammation on the nervous system. The mainstay of my practice, as many of you know, are complex homeopathics that work on drainage or healthy eliminations. And in particular with ME CFIDS, a really important piece to address is healthy drainage from the brain into the lymphatic system, into the body's lymphatic system. And the brain's lymphatic system is called the glymphatic system, GL, meaning for the glial cells. The glial cells are a network of cells in the brain that work on specialized cells and actually pieces of cells called aquaporins that help drain the sort of normal byproducts of metabolism while you're sleeping, especially. But if you've had an infection with any number of viruses, this can be particularly troublesome and need extra support. And this is part of the reason why there's a lot of brain fog and cognitive issues, is a buildup of the glymphatics or a malfunctioning of the glymphatics in the brain. So I've mentioned viruses a number of times. There can also be problems with some bacterial infections, but really ME CFIDS is looking at chronic or persistent viral issues where even after an acute infection, it goes dormant into the nervous system and the immune system. The primary viruses that are involved are herpes viruses, which is a large group of viruses, and Epstein-Barr virus in particular, also known better as just mono, right? So if you've had mono, that means that, it's latent in your nervous system. And then sometimes if you get a reinfection, or even if you have a stressful event in your life, an accident, or even a severe psychological stress, which of course many of us are dealing with in today's modern world with all of the problems and stressors that we face. But there are other viruses too, like cytomegalovirus, even Zika virus, and HIV virus, they can all have this sort of synergistic effect on one another. And then, of course, if you think about the role of COVID and how that has really changed the viral landscape, when you've got a new infection with a different virus, it can sort of reactivate some latent viruses in the nervous system, in the immune system, and sometimes also affect the hormonal system as well. So as many of you know, I like to describe my work as an intersection of the hormone, immune, and nervous systems. So there are lots of natural medicines, and really some of the most innovative products that I use are to address these patterns or signatures that are locked into these physiological body systems. If you want to know more, please make sure you get on my newsletter. And if you have specific requests for informative videos, I'd be happy to make some more of these for you. So please let me know. Thank you for listening.